What is a hallucination? A hallucination is the experience of a sensory perception despite the absence of an external stimulus. Patients find these experiences very realistic, and these can occur with any senses: visual, auditory, gustatory, olfactory, or tactile. Generally speaking, a hallucination can be defined only when the person was conscious during the episode. Auditory hallucinations are the most common type of hallucination in people with conditions such as schizophrenia and is normally described as hearing voices in the head. The voices can be complementary, but are often critical, with negative content. Sometimes the voices might be talking about the person, or even speaking coherently to the person, giving out commands and engaging the person in the conversation. One or many voices can be heard at a time. Most of the time, the person is unable to control the onset or disappearance of the voices, leaving them feeling very helpless and frustrated. The process that underlies auditory hallucinations remains largely unknown. Auditory hallucinations are commonly found in persons with schizophrenia, with a prevalence of 70% in that population. 8 to 15% of auditory hallucinations have been estimated to occur without any neuropsychiatric illness. This may have been triggered by traumatic events, drug intoxication, or other diseases such as visual impairment. While simpler auditory hallucinations, such as the inability to distinguish between noise and a tune, are thought to be related to other brain pathologies, complex auditory hallucinations with organized and structured sentences are more likely to be due to schizophrenia. According to the dialogical self theory, our brain rehearses conversations unconsciously. When there is a problem in our thought processing, we may mistake our own thoughts as signals from the surroundings, thus hallucinations. The attribution theory, however, suggests that patients attribute all sounds heard as someone else's. Contrary to auditory hallucinations, visual hallucinations are less prevalent in persons with schizophrenia. Visual hallucinations are seeing things that do not exist. These things can be an object, a person, or a picture. For example, when the person hallucinates, he or she may see a non-existent person whom no one else can see. Like auditory hallucinations, visual hallucinations occur as a result of schizophrenia as well as other brain pathologies. Simpler visual hallucinations, such as colors and shapes, are related to the latter, ranging from encephalitis, meningitis, to hyperglycemia and low levels of oxygen in the blood. More complex visual hallucinations are more closely related to delirium and schizophrenia. Other patients may have tactile hallucinations, feeling that there are moving objects on their body, such as insects, or their organs moving within the body and being touched. As these hallucinations are very realistic for the patient, if your loved one is experiencing hallucinations, do not deny their existence. Instead, listen to them and give appropriate responses.